Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, as we know, we have been discussing about leukemias in so many classes. And in that context, we have completed acute lymphoblastic leukemia and also the chronic lymphoblastic leukemia. And today we shall see acute and chronic myeloblastic leukemias. Now, acute myeloblastic leukemia or acute myeloid leukemia, if you look into the incidences, about 15 to 20% of the chances will be there. As I told, these myeloid types, so they are quite common in the western part of the world. Annually, about 2,500 cases will be reported in United States, if you see. And important is certain genetic conditions predispose this acute myeloid leukemia. What are the different genetic conditions which predisposes this acute myeloid leukemia is number one, trisomy 21. If the patient is having trisomy 21, then chance of acute myeloid leukemia is more. Diamond-Blackfan syndrome, a syndrome related to, I think, platelets structures, Diamond-Blackfan syndrome, Fanconi's aplastic anemia, Bloom syndrome, and Kostaman syndrome, paroxysmal nocturnal hemoglobinuria, and neurofibromatosis. So these are certain conditions which are genetically predisposing this particular acute myeloid leukemia. What I mean to say is, if the patient is having all these conditions, he is more prone to develop acute myeloid leukemia. Certain exposure to the drugs is also one of the major causes. We should know that alkalizers, more intake of alkalizers, epipodophylotoxins, then nitrosurias, ionizing radiations. So these two carry high incidence of or chances of acute myeloid leukemias. If you look into the incidences, onset is at all ages can occur, but most common age group is 65 to 75 years. What are the major risk factors? Yes, major risk factor is smoking, then previous chemotherapy, radiation therapy, exposure to chemical, benzenes, etc. So here they are all acting as risk factors. Looking into the pathology now, pathology is same as that of the lymphoid series, just like what is happening in the lymphoid series. Same thing is also happening in the myeloid series. In the myeloid series, it leads to the production of RBCs, platelets, and some of the other leukocytes like monocytes, eosinophils, neutrophils, etc. except leukocyte. Leukocytes are only produced from the lymphoid series. Therefore, the classification of this is WHO classification is almost all same. No need to repeat it. Now, what are the symptoms? The symptoms majorly which are seen is replacement of the normal blood cell with the leukemic cells. Now what happens is, normal blood cells, that is RBC producing stem cells, they will be replaced by the leukemic blast cells. Okay, so that's the one thing. So as a result, anemia will be the more predominant symptom here. There will be an anemia which is more predominant because normal cells of the bone marrow will be normal RBC producing cells of the bone marrow. So they will be replaced by this leukocytic blast cells. Lack of WBC is one more important thing because there is no WBC. Instead of that, blast cells are produced. So the patient is more prone to infections. Then there will be fatigue, pallor, shortness of the breath, bleeding tendency because of the platelet problems and platelet deficiency. So these are the common most symptoms which can be seen in case of myeloid leukemia. And rest of the things related to these symptoms and then investigation, then treatment, etc., they are very similar to that of the lymphoblastic leukemia. So with this we complete the series of leukemia. Thank you very much. In the next class we shall try to discuss about Ayurveda understanding of leukemia and its treatment. Thank you very much.